Kupina kuphi emakhaya emadolobheni asekomplasta khona lapho ubukela khona SABC 1. A very warm welcome to this week's edition of Yilungelo Lakho. It's your right. Lo hlelo kulinethela ke konke lokuthenga wena ke nemalungelo akho njengemthengi. Mina ke bekunene ngingisimphiwe ngcongwana. Mbukeli, the rising costs of medical aid cover is forcing so many consumers to make very difficult decisions about what? Altering their existing covers, downgrading their covers, or even replacing it with alternative medical aid covers. Mbukeli, ingambe ke kukhuphuka kwetindleko te-medical aid scheme akuphoceleli yini ukuthi ke ucabangisise ukuthi uyayidzinga le medical aid nekuthi ke uyidzinga kangakanani. Ukuphumula kabanti ke ngalendzaba kasesimukele ke Dr Sipho Kabane lomele ke i-Council for Medical Schemes, sibe naye ke na Thami Ngalo lokhulumela ke i-Oyi Medical Fund. Gentlemen, a very good afternoon to you. Thank you so much for joining us. Welcome.
Right, afternoon, thank you.
Great stuff. Ndocela ngayo Dr Kabane ukuthi asichazele kabanti ke ukuthi yini ke umsebenzi we-Council for Medical Schemes.
Well, the Council for Medical Schemes is the regulator for the medical schemes industry. In other words, medical schemes, administrators, brokers, and managed care organizations are regulated by us using the Medical Schemes Act and its regulations.
Okay.
Yeah,
All
and basically the function of the council is to ensure that we protect the interest of members and that we regulate the industry in a manner that is complementary to national policy.
Yes.
But we work very closely with the ministry by advising him, about issues that are happening in the medical schemes industry, providing him with key information for policy making. But he can also, direct us to do certain things on behalf of the health ministry.
Okay. Now, Thami, sasivile ukuthi i-Council for Medical Aid, medical schemes yona ke idlala an advisory role. So, i-medical fund yona ke isebenza kanjani? Yini kumsebenzi wenu?
I-Oyi Medical Card is a prepaid card. Kufana nje mhlambe nekhadi lasebhangi ufaka imali lapha kwikhadi lase-Oyi and then masofuna ukuya kudokotela mhlambe ufuna ukuthenga medicine at the pharmacy, uthatha ikhadi lakho, whatever funds lawa savile usavele wona uyakwazi ukuthi ke manje uye kwadokotela or uthenge even medicine. And on top of that we also then provide a healthcare advance, which is basically ifana ne-airtime advance, kushuthi airtime asiphelile or imali yakho seyiphelile uyakwazi ukuthi u-extend kancane so that at least basically uboleka imali so that ukwazi ukuya kwadokotela or uthenge medicine.
So, do I have to have a medical aid ukuze qualify for this medical card?
No, Oyi was actually designed for labantu laba bakithi who cannot afford mhlambe medical aid, is too expensive for them. So we are basically helping them ukuthi bazi discipline, basave with discipline, balokubeka imali kancane kancane. So it's both abantu abanayo medical aid ngoba medical savings funds iyaphelelwa at some point, and then laba bangenayo medical aid ukuthi basavele, particularly laba bangenayo medical aid.
So isebenza kanjani ke Thami? Nangabe ngifaka imali maybe 500 rand and then ke uthole ukuthi ke sekunesifo and medical bill yami it's far more than what I've already contributed.
Yeah, so we are only looking primarily at primary health care. So basically, because we know the majority of our medical events, some of us never ever make it to the hospital.
Yes.
So we are looking at the more day-to-day, which happen more frequently than Lama hospital plans. We are working with that. Unfortunately, as you know, that industry is held by certain individuals and people, but we are talking to them to see if we can meet each other halfway so they can help us also at this low level.
Okay. Now, Dr. Kabane, yini kumehluko emkhatsini kwe-medical aid scheme nema alternative health insurance?
Well, ngakhuluma kabanzi nge-medical scheme ya. Ukuthi mawune medical scheme, it's often called medical aid. Iyafana nama insurance products in the sense that wenza i-contribution on a frequent basis, and then if kuvela i-incident enida ukuthi uyifund, then you can put in a claim and then the benefit is offered.
Okay.
But that's why the similarities end. With medical aids here, there are several important principles that underpin it here. Firstly, there's open enrollment. In other words, anybody can join the medical schemes, irrespective of whatever characteristic you have.
Yes.
There's also community rating, which is different from what you'd get with insurance. With insurance, you get risk rating. For instance, if you've got a higher risk, you're asked to pay a higher premium. Whereas with medical scheme, it's a community-based rating. And the only thing that controls the contributions is basically your income, number of dependents, and the option that you are buying into. But in addition, our medical schemes, they've got a guaranteed benefit, which is called prescribed minimum benefit. And this is a set of 271 diagnostic and treatment pairs and 26 chronic disease lists that if on a problem included in that benefit, any scheme is compelled by law to pay for that condition in full without asking for co-payments. So that's the biggest, difference between the medical schemes and the insurance. Whereas with insurance, there's much more specificity. You get insured for loss of a car. Any replacement, it's very clear.
Yes.
But with health, you cannot determine upfront what problem you're going to have and the extent of assistance that you're going to need from your fund.
Okay. So does Council for Medical Schemes regulate products such as medical card? Or are you solely focusing on medical aid?
Basically, we are concerned more about, people that are doing the business of a medical scheme. And yes, I've heard a little bit about the card. And I think one would need to get more details to make a determination of whether these cards fall under the category of doing a business of a medical aid. Briefly, if you make contributions on a frequent basis, and those contributions go into a pool with a sole intention that when you get sick or ill or you are involved in an accident, you can then draw, put in a claim and get those paid. If that's the model that you utilize, then definitely you're doing the business of a medical scheme. And if you're doing a business of a medical scheme, you need to be registered with the Council for Medical Schemes as a medical scheme, and then you can operate legally, by complying with the Medical Schemes Act and its regulations.
Can I be controversial here? Would I be correct to say, medical aid, it's sort of a saving scheme because you use what you've already contributed? Because, I'm drawing this question, I've heard so many stories, medical aid, but they can't do anything to him or her because medical aid is exhausted. So same as the medical aid, medical card. You use what you have or what you've been contributing, and you can't use what you haven't put in.
The medical schemes industry, using the Act here, has been able to develop products here that precisely mitigate against what you've just said here.
Yes.
You don't use exactly what you've put in here, because the money that you put in actually goes into a pool here with all others.
Okay.
With the understanding that not everybody gets sick at the same time.
Yes.
So there's also an element of income and risk cross-subsidization, where you get your young and healthy cross-subsidizing your elderly and sick here. So those principles allow for the scheme to actually build up reserves up to the point that even if in any 1 year, the claims that are made by members actually exceed what has been contributed, schemes can go into the reserves. So it's not exactly you contributing 5 rand and a claim of 5 rand actually being paid. You can actually contribute less and get more because there's a pool that's looking after your interest.
Okay, Thami, I also want to know, Oyi Medical Card, does it also have a pool that will help consumers in the long term? But please hold the thought. Let's take our first call. East London.
Hello, kunjani?
Sikhona kunjani, ma'am?
Mphilena Menkosi.
Khuluma nathi mama.
I also just want to make a comment, ne? I know I prefer medical aid, as expensive as it is, but I know you get what you pay for, as opposed to health insurance whereby you pay, but when it comes to claiming, you don't get what you pay for or what you thought you were paying for. I'll make an example of an incident that I know. A person that slept in a hospital and had been trained for 2 years, landed in hospital, but now when it was time for them to claim, they couldn't claim because they had only slept for 3 days instead of the 10 days that was stipulated. Okay. Now these are the terms and conditions that maybe we don't pay attention to. So hence I'm saying I choose the medical aid because you always get what you pay for, or what you promised.
Okay, Tumeka, we lost you there, but we get the gist of your question. Thank you so much for your call. Tumeka, there in East London. Gentlemen. Dr. Kabane,
Yeah, well, I didn't get everything, but I thought she was saying that, you know, when you contribute to schemes, at least in the medical aid industry, there is the prescribed minimum benefit, which are guaranteed benefits. So in a sense, you know what you're buying.
Yes.
Because these are guaranteed benefits. Yes, there will be other benefits that sit outside there, but I think it's the job really of the member to make sure that when you buy into an option, you understand your benefits, you understand the limitations, and you understand what will not be paid by a scheme.
True.
I know this is often difficult, but I think you know, if you understand your option, you understand the rule of your schemes,
okay,
you should fairly understand what your benefits are.
All
I
right.
know sometimes they are written in a very complex way by the different schemes, and this is what we're trying to get them to simplify and standardize.
All right. Let's leave it there for now. Mbugele, asasisishilele ngasetitolo. Please do join us after this break. Leli, Yilungelo Lakho. Don't you go away. Welcome back. Sanibukela futhi embukele. Tincingo tethu solo tivuliwe ukuthi ke nawe ungaba ingcenye lenkulumo yethu. Niyatiswa ke bekunene ukuthi ke tincingo tethu setishintshile lapha e-studio. Tinombolo letinsha ke lokungatishayela kuto nyalo ngu-011 714 0669 noma ke 011 714 0670. Awuthi ngitiphinze ke 011 714 0669 noma ke 011 714 0670. The numbers are on your screens right now. These are our new numbers that you can call us on. Ungasithumela futhi ne-email ku-consumer@sabc.co.za noma ke usithole ke ku-Facebook. Namhla ke sikhuluma ke about the variety of medical aid schemes. Nekuthi ke ungabe ukhonile wena kucabanga ukuthi ke uyayidzinga le medical aid nekuthi ke uyidzinga kangakanani. Are you on a medical aid scheme? Please take up your phone and call us on the numbers on your screens right now. Share your experiences with the various medical aids that you've had. Now, Thami, earlier on, Simvile Dr. Kabane kakhuluma ngekuthi ke CMS yona ke regulator a pool of resources that have been earmarked for, you know, for the future use of members to cushion them in the future or in the long term. Kuthi ke Oyi Medical Card yona inayo a pool of resources. No, mage, whatever I put in is what I get out. Finish and clear.
For tina kusimple, there are no pooling, there is no pooling. Imali oyifakayo, i-account yakho, mawufaka 50 rand, mawubuya next week kune 50 rand. Ukuthi mhlambe omunye umuntu uphelele imali or ufake emalini ayikuchaphazeli wena as a person. And njengoba njilo isebenza njengekhadi lakho lasebhanki. Xa ufake lo mali leyo ozayifikelela xa ikhoyo, and then uyakwazi ke nokuthi uboleke kancinci xa ungakwazi mhlambe xa ngekho enough kodwa ufuna ukubona ugqirha.
Okay, short ke iphinza isebenza as a credit facility.
Yes,
okay.
But only again ikhadi lisebenza nje kuphela for ukubhatala abogqirha nabo uthenga amayeza ukwenza ama-x-ray specialists, basically any healthcare facility akwazi nokukhupha imali. So imali xa ifakile apho ihlala apho ngoba sifuna ukunceda abantu bakuthi ukuthi bahlale benemali abayibekileyo so that umuntu xa ifuna uyothenga amayeza umntana igule ebusuku ingabi ingxaki yokuthi you know manifonele umunye umuntu anincede.
Ikhona yini i-fine print? Uyabona ke lokho maganyana lokuncane lokungeke ukubone kutfole ukuthi kutakuphindze kukushaye ke ngaphambili. Sengiyabekisa ubekise ukuthi nabe ngifake 50 rand kuleli khadi, next week ngawuthola 50 rand. Angeke bese ngithola 47 rand. Ngoba phela nani you have to make money, angisho.
Exactly. So yonke information ikhona ku website yethu. If you're a regular person, you are loyal, you are faka imali yakho ihlala ikhona as it is, and yeah, we don't take, no, there are no fine prints.
Okay.
Aside from i-bank card, i-pin yakho, so if i-pin yakho inike umakhelwane wamnika nekhadi, you become responsible just like your normal bank card. But other than that, we don't have those things. Ungathatha nekhadi lakho ukhokhele nomntana next door, umntana ka-auntie, the money is yours, and mawuphuma we refund you imali yakho yonke.
Okay, so it doesn't really matter who benefits from this card.
No, it's your money, you sebenzisa for whomever ufuna ukumsebenzela.
Right, right. Let's take a next call. Sina Elvis ulapha eMidrand. Sakumodo ehleleni sawubona?
Sawubona baba njani?
Siphilile kunjani baba?
Siyaphila. Ngiba confused here.
Yeah.
I went from one scheme to another because I thought the first one I took was not good. Then I went to another one. The problem is I got a qualified GP. The GP will give me a prescription to buy medicine. Now, the medical doesn't want to pay for that because they say it's not on their formulary. So I asked myself, what does that mean? I said, this is a problem because it's like they've got their own, medicine that doctors don't approve or I don't know if I'm using the word approve. Why can't be all these companies that from maybe be under the medical association? So if it's a South African Medical Association approves this medicine, then you can say, okay, this company will approve any medication from doctors who are under the association. So that's where my worry is. I pay like 6,000 rand, 6.5 a month. I go to buy medicine for 85 rand. No, it's not under our formula. When I ask the doctor, the doctor will say, this is what will be is good for your problem, but the medical aid can't pay. So that's why I become confused.
Okay, Elvis, thank you so much for your call. Elvis there from Midrand, Dr. Kabane. And I'll come to you, Thami.
Yeah, no, Elvis ukhuluma ngeproblem common here.
Yes.
And ingxaki starta when umuntu joins that scheme. Because when you join, you need to understand the rules aleso scheme leso. And part of what the Act says, I think it's in section 32, it says that members are entitled to get all the rules of a scheme, including their benefits in each option, the limitations, what will be paid and what will not be paid. So if you miss that step, then you might find yourself utenga a product ongayinidi or a product ezoxaka later on. So I think it's very important that you do that. But yes, problem into yokuthi sna 75 schemes in the country, and each and every one of them wants to develop its own formulary. Now, a formulary list yama drugs, avunyelwe ukutaphatalwa ileso scheme. And we don't think that confusion benefits our members. Because you can imagine if you are that GP who has to deal with patients abavela from different schemes, you can't in your head be understanding wonke lama formularies avela from different schemes. Tina as a regulator would really promote, would go standardize lama clinical guidelines, nama protocols, nama formulary. I mean, high blood. Diabetes. There can be 75 ways to treat diabetes. I'm sure with the expertise that we have in the country, it's standardize a lot. Yes. So that it be clear, good morning diabetes, now my steps are landed. And whether each GP, ya like Gauteng or ya say Eastern Cape, might prescribe that treatment, it would make itself, to be relevant to that formula.
Right.
That's what we would advocate as a regulator.
Okay, Thami, you want to weigh in?
Yeah, I think ngivumelana no Dr. ukuthi it is essentially the issue of abantu when they sign up for these schemes or any product for that matter, particularly financial services, that you read up. I know sometimes lama paper, it's too many pages and they seem overwhelming, but take your time to afunde, particularly around the limitations.
Yeah.
But I think also, if you look at, sometimes we plan it's X amount of money, and then based on mhlambi, as you know, the economy is a bit tight for all of us. Umuntu ya downgrader, and then market downgrader manje akasayifuthi ayofunda ukuthi mang downgrader, what are my limitations? And then manje uthola ukuthi sekusenkingeni, the doctor umazi ujwayele kuleya plan prescribe khokha konke kanti seka downgradile kancane. So that's where the issues arise. But from our perspective as the Oyi, if you 500 rand on the card, whatever medicine is prescribed there, when you go to the pharmacy, ukwazi ukuthenga up to the 500 rand, whether it's a generic or the original or wamixa kanjani, thina zingena indawo, we are just helping people babe nemali yokuthi bakwazi ukukhokha for anything provided it's a healthcare.
So lel card lona, does it also cover hospitalizations?
No, it's, as I said, it's only imali oyifakile that you get access to. Currently, we are only looking at day-to-day. Izinto ezenzeka kaningi. We have a doctor kuthenga medicine, ama-test kanjalo. And yes, we are talking to the larger schemes, ngabo abacontroller, we monopolize the industry. Ukuthi sisebenzisane, because obviously, as you know, there's regulation on the one side, but there's also the economics of putting some model of doing something like this at this large scale. So
do you also work with registered pharmacies or, the big franchises, pharmacies, no matter just about any pharmacy that I can use the card on, including those pop-up pharmacies,
any pharmacy, any healthcare provider, the only thing is the provider must have a speed point. Ngoba ikhadi lakhona lifana nekhadi lasebhangi ukwazi ukuthepa ufake iphini yakho. And yeah, so we don't prescribe ukuthi with medicator kanjani. For example, abanye abantu bakithi baya ezangomeni, we won't tell you ukuthi uye ezangomeni or ungayi. As long as unemali lapho uyakwazi ukukhokha kwisangoma sakho akunyange.
As long as lesangoma naso sine speed point.
Yes, or a card machine.
Buke, let's take another commercial break. Hlala kaye nathi kwasanyakati siyabuya ke leli lungelo lakho, and please do remember to call us on the studio lines right now. The studio lines have changed. Our new numbers are on the screen: 011-714-0669, nomage 011-714-0670. After the break, we'll be talking about the exorbitant medical aid schemes that you've been paying over the years. What to do? Ungayishiya leyo medical aid noma ke uthathele ngelengcono noma nje uphume completely ku medical aid scheme. All this and more coming up in a moment. Leli lungelo lakho. Welcome back, everybody. Sakhuluma ke ngekukhuphuka kwetindleko medical aid cover nekuthi ke bantu ke benta njani ke ukuthi ke bamelane netindleko nekukhuphuka kwako konke kudla, i-transport, school fees nako konke nje. Kuvakalisa ke imbono wakho sishayela kucingo ku 011-714-0669 noma ke 011-714-0670. You can email your thoughts to consumer@sabc.co.za or interact with us on our Facebook page or on our Twitter page. Sinalindi ulapha ke Pitoli is our third caller. Very good afternoon to you. Sakumodo ehleleni sawubona.
Sawubona baba njani?
Siphilile kunjani mama?
Ngiyaphila. It was 2020 ngesikhathi lesa se-COVID. My medical aid was suspended. The reason it was another pharmacy. I was supposed to use certain pharmacy. I won't mention the name.
Yes.
So in medical aid was suspended. Every month I'm a premium on ayadesiwa. So ngifuna ukwazi ukuthi banelungelo lelo na.
Boloku uchubeka uyibhadala monthly.
Ngibhadala monthly, and then isizathu ukuthi uye wahamba waya ku pharmacy enye. You're supposed to use this pharmacy. Angwazi wabala ngamagama lama pharmacy abathi siwahambe, but it's a big pharmacy.
Yeah.
Nafanele siwahambe. Yes. So we are not allowed to visit the pharmacy next to us because I don't need a transport to go there. I just walk. Even Narintana, walking now. But now expect us to go to the big pharmacies in town. So, but suspend the medical. So what about my health? Because of suspended the pharmacy, so, and then I was supposed, now they say they are encouraging us to the Lama pharmacy or Malama Kuna. So the punishment is what to suspend my benefit.
Hi, I've never heard of that. I honestly haven't heard of that. Good suspend a medical aid yakho. But thank you so much. Thank you so much for your call, Lindy. Ukhona ke Dr. Kabane from the Council for Medical Schemes. Dr. Kabane, I've never heard of that.
Yeah, a problem Linda nayo. Now it sounds like ischeme sakhe senses into is illegal.
So it is illegal to suspend a medical aid just because ngithenge ku pharmacy lengekho within that network of pharmacies.
Yeah, I mean, if schemes in a network, you're a service provider, and you've signed up on that option, they can punish you by charging you co-payments if you go to somebody outside that network. But there are also konama conditions that sometimes do not allow you to even usebenzise labantu abakwi network yakho. Take for instance ukuthi uhlala ePretoria, the network yakho is around you here, and you're traveling to Cape Town, and you get ill there. Ama rules, ama prescribed minimum benefits, ayavumela ukuthi scheme must pay that in full. If for instance, provider yakho awukwazi ukuyifinyelela ngaleso sikhathi, maybe you've got an urgent problem, you can go outside the network and the scheme is not allowed to charge you co-payments. So mangimamela le problem kalindile, ingathi something is going illegal there, and bengamcela ukuthi abhalele kwi-Council for Medical Schemes, I raise a low complaint leyo.
Because what if there's an emergency?
If complainile kwi-scheme and i-scheme siyafeyila ukuresponda.
What if there's an emergency? God forbid, kune emergency manje njengoba sibayisuspendile nje medical aid. Shouldn't punishment be ukuthi nangabe ngithenga ku pharmacy le beyond or less not within the network of service providers? Why shouldn't I pay just an extra fee? Just like I would go to an ATM that's not uthola ukuthi ngiya ebhange lengasiyo lami, but uthola sengicharge 10 rand noma 15 rand extra.
Well, yiko ngithi le case le doesn't make sense here. Because even if I suspend a membership yakho, why, or by terminating, why should you still be paying premiums? So there's something that needs to be understood in the manner in which the scheme is conducting itself. But at face value, I think this is a complaint that needs to be lodged with the scheme. If they fail,
how does they lodge a complaint then?
Well, you can write to the principal office of a scheme or a dispute committee in a scheme.
Yes.
But if you exhaust those internal processes, or you feel that the scheme is assignating a lot, you can come directly to the Council for Medical Schemes. We've got a complaints department that's ready and willing and
Please share
able
those
to
details
deal.
because Lindy is watching right now.
You can write to information@medicalschemes.co.za.
Okay.
But in a number now, I share nama listeners of the viewers here.
Okay, all right. We're definitely going to put up the numbers on your screens. Thank you so much for making that point. Thami, sikhulumile ngaphambilini ukuthi ke le card leli Oyi Medical Card ungaya kunoma ngiphi ke i-pharmacy. So what are some of the problems that you've heard from my users ukuthi ke badibene nato?
I think my problem is associated with firstly not understanding or maybe confusing Oyi with a medical scheme. So sometimes mhlambi afuna ukhoka as if it's a medical scheme bese mhlambi a pharmacy, but you know we don't take this scheme, we don't even know the scheme. Kanti what you're supposed to do is request your medicine, go to the till and then ukhoke ngalo ngoba lisebenza njengecard lebhangi. I think one of the issues also would be, for example, so it's more that are technical rather than which you mix the medicine or njalo. So because we don't play in that field, we don't prescribe, we don't tell you, we don't limit to what medicine, we don't do that. And then obviously you know, figure pianos amukoka penal wrong. So those are the types of issues, not at the medicine level or at the service provision level. No.
So do you think members and users are educated enough about some of the terms and conditions of this card?
Look, I think it's a banking industry because we are more in the payments and banking industry. It's a banking industry problem. So as banks, normally it's a bank A or bank B or Oyi, knowing how to use your card. Sometimes the card, bashala phezu kwalo liyagobeka. And the muscle gobekile yazi ukuthi namakhadi wethu anama-cheap. Mawufika lapha uthi uzama ukukhokha ikhadi alisasebenzi. So and that's an industry-wide problem. It's not an Oyi problem, but obviously my users bona mabebona problem it's this thing Oyi ayisebenzi. So those are the things that we deal with, but yes, education definitely is an industry-wide thing.
Okay. Now, Dr. Kabane, let's talk about the exorbitant costs of medical aid. Where does the Council of Medical Schemes come in terms of regulating the pricing? Because I do understand CMS has proposed that medical aid schemes keep their price increases below inflation. That's 5.7% for next year.
Yeah, the Council for Medical Schemes on a regular basis around about July, we publish a guidance to the medical schemes industry in terms of the inflationary contribution increases for the following year. And yes, when we publish this, AMA schemes, they take us very seriously. And obviously, we are also very careful of not being prescriptive, malama percentages that we recommend, because we also understand AMA schemes in terms of size, our funny, in terms of their financial muscle, our funny, in terms of the size and of the pool, our funny. So this just serves as a guidance. And yes, we are happy with the cooperation that we have received from the schemes.
But why though? Why don't you crack the whip on those medical aid schemes that are charging ridiculous prices, especially for the least affording members?
Well, the issue is it depends on what option you have bought into here.
Okay.
Because a contribution increase will only be applied to the base money that you are paying already.
Okay.
So if you choose a comprehensive option, it's going to be more costly. And when you add the annual contribution increase, it will be exorbitant. So where we come in is we encourage schemes really to keep these increases low, because it's also in the best interest of schemes. Because when they lose members, their pools become smaller and the sustainability of that scheme can be threatened. So it's important for the scheme to maintain and even grow its membership so that that pool is increased. And when you've got a bigger pool, you get cost effectiveness and sustainability of the scheme. And when a scheme prices itself out of the market, abantu baya next door bayobheka enye product abangakwazi kuyi-afforda.
All right, let's leave it there for now and let's take a break. We'll be right back. Yilungelo Lakho. Welcome back, everybody. Namhlanje sikhuluma ke ngema-medical aid. Nekuthi-ke, are they really worth it? Is it really worth paying what you're paying every month? Nekuthi-ke, uyakuthola yini lokubhadalelako ku-medical aid. That's our core of our discussion today. But before we get into our discussion, let's take our next caller. Sina Mike, he's right here in Johannesburg. Mike, sakumele ehleleni sabona.
Yebo, ngiyazobhuta njani?
Siphilile kunjani baba?
Ngiyaphila.
Khuluma nathi baba. What's on your mind?
Yeah, bengicela ukubuza ukuthi ngingumuntu ophuma ngaphandle ngine passport kumbe i-aslam ngiyakwazi ukuyina in the medical aid.
Okay, Mike, great question. Thank you so much for your call. Siyabonga kakhulu ukushayela. Dr. Kabane, nangabe ke ngiphumela ngaphandle, like ngibuya ngaphandle, do I qualify for medical aid?
Certainly. Uyakhumbula ukuthi ekuqaleni ngithe one of the principles underpinning medical aids is open enrollment. Meaning that irrespective of who you are, your age, sex, your ID, as long as you are able to pay for an option and pay for the dependents, and you've got the income to afford that, the scheme will accept you.
Passport, permanent residence, or produce?
I'm sure your passport would serve as an ID.
Okay.
A specific identifier. And I'm sure schemes would accept that.
Okay.
But if you've applied for a South African passport, ID, it would even be better.
Okay.
Yeah.
And I'm going to extend the question to Oyi Medical Card. Do I qualify?
Yes, you do. We just need your passport. So, ting passport yako, the copy yako for FICA purposes, and otherwise, yes.
So, akunenzaba ukuthi ngihletile eSouth Africa sikhathi esinganani. Thola ukuthi I'm on business for a week or a month or maybe 6 months.
No exclusions.
Okay.
It's like, well, Vulikati. The only thing is we will sebenzisa la eMzansi Africa, of course. So if you are here for a week, you will put your money there, and then every time you come back, maybe uzo visit, you'll be able to use your card la eMzansi.
Okay. Yeah. Now, Dr Kabane, yini ke i-medical aid lengakubhadaleli? Asesithi ke sengisesibhedlela and I'm critically ill. Nangikhipha ke medical aid card yami bangitshela ukuthi no, your medical aid cannot cover this. Lapho I'm close to death.
Yeah. That's the reason why, Sitama member, before you sign up on your scheme, you need to understand the rules, the benefits, the contributions, nama limitations, nama exclusions.
Yes.
So with this scheme as bhataleli lokho. But in general, if you've got a medical aid in South Africa, there's a certain group yama benefits are guaranteed that no scheme can say you've run out of money, or you don't qualify for. And that group, prescribed minimum benefits. There are 271 conditions, now 25 chronic conditions that fall into that basket. So when you buy into an option in South Africa, that is guaranteed.
Okay.
So I think it's important ukuthi the option oyithengayo i-comprehensive kangakanani or i-rich kangakanani ngama benefits. If you go for the low-end option or entry-level option, uzothola ukuthi nama benefits akhona mancane, but nama premiums akhona are limited. But the more comprehensive your option, it's going to cost you more money, but you're going to find ukuthi ama benefits are also rich.
Okay.
So it's just a question of understanding the option oyithengile nokuthi ikunikeza maphi ama benefits.
I want to ask you after this call, I want to ask you what should I consider for me to take the lower end of the package or the comprehensive one? But please hold your thought. Let's take our next caller. We've got anonymous call from Greytown. Sakumore ehleli sawubona.
Sawubona futhi ninjani?
Siphilile kunjani mama?
Ngiyaphila futhi.
Yeah, khuluma nathi mama.
Yes. Bengithi la ngicela ukubuza futhi kanjani une-medical aid uyayikhokhela then masulalile esibhedlela kucheke isibhedlela singayitholi yonke imali yaso bethu yabakweleta so ugcina usukhokha isikweletu esingaka futhi like nabengiyoteta April so sebethi ngiyabakweleta imali close to 15,000.
Nangabe uthola ukuthi bosolo uyibhadala le medical aid but bakutshela ukuthi seyiphelile imali ekhadini lakho. Ngabe umbuto wakho leyo mama?
No, imali bathi bona bakhokhile baqedile esibhedlela but isibhedlela sona sisathi ngiyasikweleta.
Okay, all right. Maka siyabonga kakhulu ukusishayela ukhona ke Dr Kabane ukuthi awuphendvule lo mbuto wakho. Basically what the anonymous caller is saying ukuthi ke kwente kanjani lokuthi nangabe ngiyachubeka ngibhadala medical aid and then esibhedlela for medical assistance ithi ke medical aid no yena ikubhadelele bekumele ukuthi ikubhadale but isibhedlela simnike ibill ukuthi no you actually owing us.
Yeah, let isibuyisela back to la kufanele kuqale khona as a member of a scheme. Because unless you understand ukuthi le option oyithengile ikunikezani.
Yes.
Then for instance if for instance umama uthenge an entry level option uzothola ukuthi ama benefits akhona are limited. All right? But ngishilo ukuthi ama prescribed minimum benefits are guaranteed across all schemes.
Okay.
So the only difference is ukuthi abantu belong to the same option but khokha imali different income nama number of dependents.
Okay.
All right, but basically if you understand the option nama benefits akuyo then you'd understand. Enye into engifuna ukukhuluma ngayo ama networks. If usayina eschemini esithi faneke uye esibhedlela esithize utreatwe udokotela othize and then they will pay in full. If you deviate uya kwesinye isibhedlela or utreatwa omunye udokotela or outside le network oyisayinele wena, ischeme uzothola ukuthi siyabhadala but asibhadali yonke imali eclaimiwa ama-service provider.
So kumele ukuthi ngibhadale extra from my own pocket.
That's correct. So,
But is it fair though ukuthi medical aid ingadictate ukuthi ngiye kusiphi isibhedlela?
i-medical aid ayidictate here. Iyasho ukuthi if uthatha le option, ihamba ne-network. And when you sign on to that network.
Okay.
And ma obey ama-rules and network, iba khona le co-payment, which is supposed to be a disincentive for people to move away from the network.
Okay.
So it's very important to understand ukuthi mawuthenga i-option ihamba ne-network na,
Right.
or is it an open and you see the more comprehensive option is, the likelihood is that there are no restrictions of a network. But if you start with a low end option, there's a chance that there's a link with a network.
So what should I consider before ngithathe a comprehensive one?
Well, if a comprehensive one, like I said, into dictate ukuthi what package you want here. Firstly, you need to look at your own needs.
Okay.
Look at your age, look at your state of health, and look at your income and the number of dependents that you have. That's what determines the package that you need to get.
Okay.
If, for instance, you are old like myself, you probably have some chronic illnesses,
Right.
and you need a more comprehensive plan that will cover for all of those things. But if you are young and healthy, you might find that you don't have any chronic problem.
Yes.
Ugula once every 6 months.
All right.
So
Point
you'd
taken.
find that a lower end option is more suitable to you, and it will be more affordable for you. Yeah.
Okay.
But
Now-
obviously, as you grow older, you become more sick, and your health needs
Right,
are
right.
increased, and you have to pay more.
I'll come to you in a moment, Thami. But for now, let's take a final break. Asasihlangane ke nasasibuya etitolo. Leli Yilungelo Lakho. Don't go away. Welcome to a very, very last segment. Siyaqhubeka futhi nendaba yethu namhla ke ma-medical aid. We've got our caller from Durban. I'm going to ask my colleagues to remind me who the name is, by the way. Okay, sina Gugulethu from Durban. Gugulethu, sawumele ehleleni sawubona.
Alo bhuti wami njani?
Siyaphila kunjani mama?
Ngiyaphila bhuti. Ngicela nginombuzo la bhuti wami.
Yeah.
Ngisebenzisa uGems Medical Aid.
Yes.
Ngiyi-option e-Emerald. Ngisho ukuthi ngike ngalimala ngo-April nama-scans engenziwa wona. Then last weekend kwase kuba umntwana waba ne-problem waba nama-gallstone bafuna bamenze operation kwaba ne-CT scan okufuna bamenze yona. If sengiya ku-Lake Smith ekufuna benze i-scan bathi ama-funds awafuna i-scan lesi sisu-13,000 sisonke. Thina ngisikhokhele mina leyo mali. Sengiyabuza ukuthi uGems kanjani? Why ehlanganisa imali yama-dependents wami kanti umuntu akanayo imali yakhe yedwa njengoba ngikhokha ngi-enda phe ngikhokhe u-3,000 before benze umntwana wami ne-scan ngakhokha u-3,000 up front then ngenze i-arrangement sokuthi ngizokhokha lenye i-balance with u-Lake Smith.
Okay, this is Gugulethu at Durban. Sabonga kakhulu ukusishayela. Thank you so much for that call. And I guess it adds to, it adds a different dimension to this discussion. Does the CMS also regulate e-GEMS as well, which is a government, government employees medical scheme? Yeah?
Yeah, CMS regulates GEMS, namanye schemes.
Okay. So how would you answer Gugulethu's question then?
The problem kasis Gugulethu is one would need to see all details ukuthi kwenzakaleni. But from what she is saying is that she's now accessed radiological services several times. Now, more contributor every month to a scheme, there are two things that happen here. Part of what you're contributing goes into the pool, but some of that amount remains in the what is called the savings portion.
Okay.
Now, often, mawufuna i-service outside the risk pool, like if it's outside prescribed minimum benefits, the scheme pays for that here from the savings portion. So if i-service ethize uyisebenzise kaningi here, uthola ukuthi lama savings also now ayezansi. And mawuclaima from the scheme, mabe-check bathola ukuthi awusena ma savings. So the only thing that you are entitled to at that stage, ye condition or a claim related to the risk pool. Anything outside the risk pool, you have to pay from your own pocket.
Okay.
But bengacela usisigugu ukuthi abhalele ku-GEMS, a-check ukuthi kwenzakaleni, bamnikeze wonke lama answer awafunayo.
Okay.
And if akekho satisfied, angabuya aze kwi-Council for Medical Schemes.
Okay.
And then say investigator lento sibone sikwazi ukucacisa ukuthi kwenzakaleni.
Okay. Now, Thami, you know, there's so many misconceptions about medical aid because people think it's medical aid, it's unlimited. Ngivekele omunye athi awuthina be medical aid noma ngabe sengene inyama la etinyweni sengikhokha ku-doctor. So how would you dispel that myth with regards to medical aid?
Yeah, I think it is correct that it's a perception, a correct perception ya medical aid ukuthi abantu bakithi think ukuthi once I have a medical aid and sibona thina from outside, they have this perception ukuthi once ngikhokha medical aid I have unlimited funds. So njengoba usho any problem nje ngifika doctor produce medical aid and they'll pay. Kanti every plan, even the top one, they have their limit.
Okay.
Maybe they are much higher, so to make it as well richer. But every plan has a limit. So abantu bayenzayo, because for example on outside, angithi imali yabo abasavela yona. So abantu they are more particular ukuthi i-service ethize malini, costa malini kuphi. So we find them shopping around. For example, ufuna ukwenza procedure ethize, uyabuza ku doctor ukuthi le procedure imalini kulesi sibhedlela.
Right.
Doctor amtshela ukuthi no, here it's X.
So ngitfola njani ke Oyi Medical Card?
Oyi.co.za is our website. Khona ne WhatsApp number laphayana abantu siyakwazi ukusiza.
Thami Ngalo and Dr. Kabane, great chatting to you, gentlemen. Thank you so much for your time.
Thank you very much.
Thank you.
Thank you. Hayi ke mbukela sesifika kanjalo ke maphethelweni ehlelo lethu namhla. Ngithaza ibonga tivakashi tethu ngesikhathi sato. Ngithaza bonga kanye nani ngibabukele ngoba nathi kuze kube manje. Please do join us again next week and for another consumer affairs discussion with Alicia Jale. From me Simphiwe Ngwane and the rest of the team size ke nitsale kahle. Do have a great week. Cheers.